Mobile healthcare is not just a smaller version of real care. It's the same care, just delivered where people actually are. And that one difference is what keeps people connected to healthcare that they would otherwise lose. In this video, I will explain what mobile healthcare is, why it exists, and what it can actually do. So let's start off with describing what mobile healthcare actually is. Because I go out on the road a lot, and the picture that people have in their minds, it's actually wrong. It's inaccurate. So in the simplest form, mobile healthcare is where the care travels to the patient instead of the patient traveling to the care. Picture your typical bricks and mortar location. You're going to have all the equipment. You're going to have trained staff. You're going to have an exam space, except that's on wheels and it travels to where people are. So that can be a community center parking lot. It can be a neighborhood that hasn't had a clinic for years, or anywhere you want to set up. Often I'll be talking to people and their impression of mobile care is it's just a watered down version of real care. But it's actually held to the exact same standard of care that you would find in any bricks and mortar location. So it's going to be the same exam. The screenings are the exact same. The only thing that really changes is the address. So a lot of the organizations we speak with that are looking to help people and the people that need the most support, the address is actually the problem. And for millions of people, the nearest care keeps getting further away. So I'm going to give you an interesting statistic here. Since 2005, nearly 200 rural hospitals have closed or stopped offering inpatient services. And that's according to the Shep Center at the University of North Carolina. You can imagine when a hospital closes, it can leave an entire region without care nearby. And even when care exists on paper, reaching it can still be a barrier. So if your closest clinic is an hour away, and let's say you can't drive or you can't take the time off at work, that appointment simply doesn't happen. Transportation is one of the biggest reasons that people skip care, especially preventative care. And so mobile healthcare exists for that very reason, to close that distance. So bringing care to the closest community makes three things easier right away. So number one is time. A visit that used to take an entire day off work just becomes a quick stop on your way home. Number two is planning. So when a mobile clinic shows up on a schedule, people can just plan that right into their lives. And the third one would be stress. So a familiar local place is much easier to walk into than some strange clinic right across town. So you can imagine when care is easier to reach, people tend to follow through, and that influences real outcomes. A lot of what sends people to the emergency room isn't a sudden crisis. It's a small thing that wasn't caught that grows into a big thing. So if you catch that early, close to home, you can prevent that emergency before it becomes a big crisis. So quite simply, mobile healthcare is not what most people think it is. If you're thinking that it's just flu shots and blood pressure checks, that's only a fraction of what it actually is. Mobile units can handle your primary care, such as mobile exams and basic treatment. They also can provide preventative care, such as screenings, immunizations, and health education. But it goes even further than that. So mobile units provide specialty care as well, such as maternal care, behavioral health, and even dental. Those are often the hardest services to reach in rural areas, and mobile units can bring them right to where people are. And in a public health event, a mobile unit can become a rapid response tool, providing urgent care and testing exactly where the need is the greatest. The key thing to remember is that mobile health care is not trying to replace the entire system. It plugs into it. A mobile unit extends its reach into places a bricks and mortar location can't go. So a patient that doesn't want to or can't make the drive downtown gets seen in their own neighborhood instead. And it's already happening at scale. The Mobile Health Map reports that mobile clinics see millions of people across the US every single year. So this is a proven model, not some experiment. And that's where we come in. We don't deliver the care, we build the vehicles that make the care possible. So we've worked with healthcare organizations across the entire country. Our job is to turn a healthcare team's mission into a vehicle that brings the care across the community. So to wrap all of that up, what is mobile healthcare? It's the same standard of care brought to the people who would otherwise not receive that care. It exists because the distance to care keeps growing, and it works because it removes the everyday barriers that stop people from showing up. And that means that problems get caught much earlier and not just in the ER. So if you're thinking about starting a mobile clinic, we have a 3-part series on how to do that. I've linked up video number 1 here. If you have any questions, put them in the comments below. We're always very happy to help.